Dear medicos, we are having the honor to have Dr. Aman with us, our DAMS Jaipur student, getting ranked 96 in the very first attempt. So, beta, congrats on the behalf of DAMS family.
Thank you so much, sir.
How you are feeling, beta, after getting this double-digit rank in the very first attempt?
Sir, I'm feeling very good, and sir, I couldn't believe it for 2 days, and now I've been partying straight for 2 days, and I just got home this morning, and it's amazing, sir.
So, beta, we congrats you and your family for this awesome achievement. So, beta, I will be using this platform like you're our foundation student. You were attached with us for the last 3 years. So, I'll be sharing your experience, how it was possible for you to get this double-digit rank in the very first attempt. So, beta, let us start with like you join us in the 3rd year in our DAMS Jaipur Center. So what was the role of that classroom learning in your preparation?
Sir, it made me realize the importance of first and second year subject in the 3rd year sir, it was a very amazing experience because after COVID, everything had become online and it lost its touch what you get to learn in the classroom. So, sir, in the classroom, even though you're not directly interacting with the teacher, but when the teacher speaks in the classroom, it gets into your memory, and it has a very important role in laying the foundation for the preparation.
So बेटा अमन जब आप 3rd year में when you were attending the lecture, तो आप notes लिखते थे, तो वो self written notes ने कहाँ पे आपको help की for getting this rank? What was the role of those self written notes? हाँ जी.
Sir, self written notes are the most important thing. In fact, the notes are the most important thing for the preparation. And sir, because of those self-written note, I get to remember which thing is written on which side of the page. Even if I don't remember I don't have a proper recall in the exam, but there is a fade memory of the notes that I have made with my hands itself. And so, yes, sir, self-written notes are very important.
So, better like you joined our classroom in 3rd year. So I will be starting like all the students, all the medicos were the first year listening to you. Like you're the best student, being a fresher, being an intern, you cracked this NEET examination, which was a typical examination, which was very conceptual question. Bank was there in the last NEET examination. So what advice you will give to the first year student, like a student in the 1st year, how he should proceed?
Sir, I don't know if I'm the right person to give that big advice, but sir, in the 1st year, we usually don't realize that we are studying for such a big exam. So I would say to take it easy, not go very hard on yourself in the 1st year itself. But as you grow, you should be developing a seriousness towards the exam. And it's okay that you read anatomy, physiology, and biochemistry superficially in the 1st year. But as you go, you will soon realize it by yourself that these are very important subjects as far as the clinical subjects are correlated with these subjects.
So when like in the 2nd year, if a student is in the 2nd year, what you will say role of basic sciences of 5 subjects, patho, micro, pharma, anatomy, physio in the new pattern of NEET examination?
Yes, sir. Sir, I think pathology plays a very big role, and it is a subject that is connected to almost every subject. So if you are reading Robbins, like I think everyone should read Robbins, sir, because it has such a good language, and not all the chapters, obviously, because there's a typical language of Robbins, which is sometimes hard to understand. But yeah, giving a shot to Robbins is quite a good idea in the 2nd year itself. And as far as pharmacology is concerned, you will get to know that it has also a big role in the clinical courses, and like microbiology also plays a big role. So yeah, you shouldn't ignore these subjects, and don't read it like you are reading an individual subject itself. Like you have to correlate, and like this new pattern makes you correlate, and you have to read it integratively.
So in the last 1.5 years, like of COVID, where every was under big pressure. But we came with a live concept of all the lectures on e-medicals, and we taught you all the 19 subjects in the integrated fashion. So, beta, what
Yes.
was that learning? What was the role of that learning in your success story?
Sir, I think it played a pretty big role because like when I was preparing and I started preparing in March, and I had my notes completed in internship itself. So I didn't realize that I was lacking anything. Like when you read something, you don't realize actually that you had missed this point or you had to read this important point. So it is because of DVT itself that I made that it made me realize what all points were important and what all point I have to focus. So after DVT, my scores improved significantly. So the online learning was it played an important role in raising my scores. And sir, the classes were interactive as well, not like the teacher is teaching. The students can interact and the teachers were solving their doubts. And the DVT itself was an amazing experience because all the teachers came together, enjoying, laughing, singing, and teaching. So that was a very nice experience, sir.
But you were using a word interactive session. So we were very proud to share in the last COVID era, we came with a new concept of live lectures because nobody was thinking about this. Okay, yeah, faculties will be teaching from their room itself, but it was possible
Yes, sir.
because of the innovative concepts of Dr. Sumer. So what you feel like in discipline, what is the role of interactive sessions? What was the role of discipline in their live lectures?
Sir, in live lectures, also it has to be interactive, sir. Because if you are going on making notes and just reading it, and it gets monotonous, and you will obviously get bored because no one can read 19 subject with one go and just reading and reading. So interaction is must. And when you read each and every line of your notes, you get to realize what all doubts you have in your mind. And no doubt is silly because I have seen that when I ask a doubt, or when it compels me to search for it, sir, I have realized that many times the question was in the next GT. So, sir, interacting with the teachers, asking doubts is a very important thing to do.
That's great. So, but when you were attending all the live sessions and you were writing your own notes, what was the importance of self-written notes in the success journey?
So self-written notes are very important because if you read a notes made by someone else, you don't know what by what intention he has written the notes. And like I make small corrections on the notes and the extra points I have written. So sir, you can't understand that by the notes written by someone else. You have to write your own notes, and it remains in your memory for a much longer time as compared to all those printed notes and written by someone else. So yes, sir, written notes are very important.
That's very true, but okay, we should not follow any shortcut and we should write our own notes, which will definitely place up somewhere in the subconscious mind. You're revising the topic.
Yes. Yes.
So, but like you were attending our live sessions on e-medicals after this COVID, what was the role like this PG preparation? But as a faculty, I feel is a time-bound game. Like 19 subjects, we have to complete in given time slot. So what was the role of these live lecture into that time management?
Yes, sir. Absolutely, that's true. That is a time-bound thing to do, all the 90 subject, and it's pretty big task. But since the COVID happened and all the delay that happened, we got some extra time in hand. And I'm pretty thankful for that because if I have been given the exam in January, I wouldn't have scored that much. It is because of all these interactive sessions that DAMS has come forward with. I have been able to score this good. And yes, sir, that extra time you have in hand, don't consider it like, okay, delay ho gaya, fir se delay ho gaya, fir se delay ho gaya. You have to think it as an opportunity and get as much as the content you can get. Not everything, but all these high yield concepts, integrate everything, physio, pharma, all that time. And sir, I have been making notes in my digital apps and making the brain map. The Deepti ma'am has taught us to make brain maps, sir. That was an absolute gold because at the last time of the in the last times of these exams, you can really revise it really fast. And since it is made by you, it will be very easy for you to revise in the end.
So, beta, but I'm getting very nice motivation I'm getting from your words. कि when the exam was delayed, I have two options. या तो मैं negative सोचता हूँ, I say कि why the exam is being delayed, why it is happening to me. Or the second positivity is कि I will take this as an opportunity to revise once more. Very good, very nice attitude you are sharing on this platform, and I feel every medico should take this motivation instead of wasting time in criticizing why the exam is being postponed, because it was with everyone was on the same boat.
Yes, sir.
So it is better to take the opportunity to revise again. And now after this, every student must be asking you, okay, Aman, how many times you revise the notes before getting this rank?
Sir, I couldn't even remember, sir. I got so bored of the notes. I kept looking and looking, and the one time I was like, "Kya matlab, we are just turning pages." And but yes, sir, those turning pages itself was played an important role, because you don't realize, like, it gets into your subconscious, and this exam uh, plays with your subconscious, because you don't have that much time in the exam, and subconscious has to play a role, because something that you have read 10 times you cannot forget, even for very long time. I think so, sir. I think I revised the notes 3 or 4 times easily, and it is because of that extra time. Obviously, I couldn't have revised if the exam was in January, but yes, sir, I've revised my notes pretty well. And I think, and which is the most important thing, I think the notes revision is the best thing to do.
After writing all yourself, after revising all your self-written notes 3 to 4 times, and side by side, you must be doing the MCQs from SWT grant test. So now
Yes.
coming on the MCQ part, beta. Quality of MCQs in grant test, SWT plus test, if you compare with the last NEET examination, what you will say?
Sir, I think since the pattern changed, no one knew what would come in the exam, and everyone was expecting clinical vignettes and all the long stem questions. So, sir, I did clinical vignettes module, and sir, it was really good. It gave the feel of MLE type exams, and it was fun to read all those long stem questions, even though you are not doing it in a time bound manner. But the question you read and then you make a diagnosis, it was really, it really gave a feel that you are actually sitting in an OPD and solving questions, solving the patient's problems. So and as far as the questions are as we consider the questions in the SWT and the grant test, sir, everything was concept based. Even the concept exam was concept based. So I think doing questions like based on clinical vignettes are pretty important for this exam, even though exam didn't have that long stem questions. But since you are already doing those long stem question, it will be easy for you to do that 2-3 line questions, even though they are clinically integrated.
So, but like coming on the MCQ part, I want any specific strategy you want to share, like art of attempting MCQs. Why? Because last NEET examination, time management was the big issue.
Yes.
Do you agree with this? The last paper was NEET exam was lengthy.
Sir, I don't know many people will agree with me on that, because I usually get over with my paper like 45 minutes before.
That's
so
great.
Yes, but I think most of the people found it lengthy, and it is because of the fact that the question was not confusing, but the answers were like close enough. So you have to give your time on those questions.
That's great. So, beta, we again congrats Dr. Aman, SMS Jaipur, proud Damsonian, for getting ranked 96 in the very first attempt. So, beta, I am sharing this platform to guide, to motivate all the students listening to you across the globe. So, beta, in the last spell, when you attended DVT session, what was the experience of those 7 days, and what will be advice to your juniors how they should study in an integrated fashion?
Sir, DVT played an important role, as I said, as I said in my scores, and because of that DVT, I get to know that you have to really integrate subjects like ma'am teaching physiology, and then you have pharma, and then you have the typical medicine questions on cardiologist, for example. So yes, sir, integration is very important, because when you're reading a question, it's not like you are just reading a theory, or you are getting a question from a particular subject. It will be integrated. So you have to pick up the buzzwords and the keywords from the questions, and you have to move on as fast as possible. And for that, you have to do many questions that are clinically integrated, and you have to learn to pick up the keywords so that you can solve really fast. Like there was a question on HSP in the exam, and if you have done enough questions on like the vasculitis part, you'll easily get to know that this is HSP. You can mark it by closing your eyes. So yes, sir, that is pretty much important. And as far as DVT is concerned, sir, those 7 days was just amazing. I never sat in front of screen just like 10 hours or 12 hours. So DVT made me do that, and I was really enjoying the part. And at the end of the session, when all the teachers came, joined and interacted with us, played songs, so that was also a nice experience. And yes, sir, DVT is very important, sir.
So, beta, we congrats you again for such an awesome achievement. And I'm using this platform. Everybody listening to you should just follow your footprint to get the rank in the very first attempt. So, beta, any special message to all the juniors, like any motivation you want to share for juniors? First for SMS Jaipur, then rest of the country.
Yes, sir. Sir, SMS Jaipur has been amazing for the past 1 to 2 years, and we are getting amazing ranks from our colleges. So I don't think people need motivation, because they are already motivated here so much. And as far as my juniors are concerned, I would say that please don't panic during the preparation. Like you haven't studied for 6 hours, 7 hours, and you blame it on yourself that going on a guilt trip that मैं तो कर ही नहीं पाया आज के 6 घंटे. It doesn't matter. The amount of time you give to study doesn't matter, but the content you are reading and what goes into your mind, you have to concentrate on more on that. It doesn't matter that आज तो 5 घंटे ही हुआ, फिर अब उसके चक्कर में आप पूरा दिन खाली निकाल दोगे कि अब नहीं हो पा रहा, अब नहीं हो पा रहा. Do something. If you're not reading, do MCQs. If you're not doing MCQs, play a video, something, or make a short notes about your notes so that it is easy for you to revise in the exam times. So yes, sir, motivating thoughts, it's just exam. Don't take it like it's your life, and you will get it easily. Matlab, you have to work on the clinical vignettes parts and building basic concepts. Don't just take first and second year subjects for granted. You will get to solve most of the clinical MCQs from that part only. So yes, sir, and please, it's just an exam, so please don't go like ab mera kya hoga, exam mein hua hi nahi, or going on a guilt trip. It's just an exam.
Very cool mindset is required for getting a good rank in this examination. But I feel apart from academics, you should be mentally very strong if you're aiming for a top 500 rank. Very true, very true. Thanks a lot. And Aman beta, what was the role of all the motivation you were getting by all the DAMS faculties in the classroom?
Sir, the motivation was amazing, because when you're sitting in front of a professional like a surgeon or a dermatologist, it really gets you the feel that one day you will be there, and you might be teaching, you might be practicing, it doesn't matter, but the person sitting in front of you giving such motivating thoughts was a nice experience. And also I would like to add the role of my friends. I had such an amazing friend group, and we were like not at all competitive. We were like solving each other doubts and motivating each other. Like you don't have to get all the panicky when you have not scored anything in a GT. So yes, sir, the teachers and my friends and my family, they were really it really made me feel that.
Please kindly unmute, beta. Kindly unmute here. Yeah, now it's fine. Now it's absolutely fine.
Yes, sir. So yes, sir, the motivating thoughts that teacher gave to us was really inspiring, and yes sir, it really helped.
Last question to you. When you were sitting in the DAMS Jaipur classroom, those efforts you have taken for continuous, like you're sitting from morning to evening attending lectures, that hard effort was not easy game, but you did, and now you're getting ranked 96. What was the role of that discipline, hard efforts?
Yes sir, I remember sitting in the lectures for 10 hours, and like in the half of the lecture, sometimes I get feel just like let's go home. I can't do this. I can't sit so hard. And sir, I get very hungry. I get very hungry every 2 to 3 hours, and I was like, कब break होगा, कब break होगा. And बहुत बार सोचते थे कि बस अब चलते हैं, बाद में अटेंड कर लेंगे, नेक्स्ट ईयर अटेंड कर लेंगे. But it's not like that. Please do it, and थोड़ा सा बस मेहनत की जरूरत है, और अगले साल आपको वो क्लास अटेंड नहीं करनी पड़ेगी. जब आप नहीं कर रहे होगे अगले साल, वो आपने ऑलरेडी कर रही होगी, तो आपको पता चलेगा कि कितना अच्छा किया, हाउ नाइस दैट डिसीजन वाज टू स्टे इन द क्लास एंड अटेंड द होल लेक्चर. एंड प्लीज डू इट. एंड सर, yes sir, I was really hungry, so I had to take a break in between the lectures, but anyways I did it, and I am thankful to that.
That's great, beta. We congrats you, your family, convey our wishes to them, and we wish you very best of luck. Thanks, beta. Aman,
Thank you
nice
sir.
talking with you, and you have given awesome motivational word to your juniors. Thank you, beta.
Thank you sir.